Hi, I'm Randy Alvarez. Welcome to this week's Randy Alvarez Marketing Report. I'm on fire about this topic. I know there are consultants that are telling you that you should charge a consultation fee, especially if you're a plastic surgeon, dermatologist, cosmetic dermatologist, or a cosmetic dentist, or some sort of specialty within dentistry. Charge for consultations. I hear these consultants saying, look, your time is valuable. You don't want to. Well, here's the problem with all this. The word on the street is consultations are free. People don't pay for consultations. If they call your practice, and I'm really talking about on the telephone, if they call your practice, they're excited about getting started, and you say, well, there will be a consultation fee with the doctor because the doctor's time is very valuable, blah, 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 blah. What ends up happening is they may book at that moment, but what ends up happening is they get off the phone, they tell their friends, and they see, I'm going into Dr. Jones. He charges a consultation fee, and there's a good friend of mine that's a plastic surgeon that he was doing this as well. And what's happening is people were canceling all the time, because what happens is they would tell one of their friends, I'm going to this plastic surgeon for a consult for my neck, and their friends would say, you're paying for a consultation? That's ridiculous. And so what ends up happening is their friends and family talk them out of it. There are so many plastic surgeons that don't charge consultation fees that I don't know if you want to be the one that does. Now, your time is valuable. So this is a big topic because there have to be systems both on the telephone, systems when they get there, so you don't waste a lot of time with people that aren't going to do procedures with you. But again, my whole premise is that if they arrive at a plastic surgeon's office, this is why I think you should never charge a consultation fee at a plastic surgeon's office. Look, people don't like going to a plastic surgeon's office unless they're seriously considering doing something. They don't like something about themselves, right? They show up. If you do a proper need analysis, if you dig for purpose, then it's easy to design your presentation to fit them. It becomes impossible to refuse. They don't have to go somewhere else, and you don't waste your time. So no matter what, now let's talk about dentistry because this is happening all the time. I would say that 80% of dentists don't charge consultation fees that I deal with. On the $8 million, $10 million a year practices, not only do they not charge consultation fees, the owners of these practices go, Randy, it is incredible that people are charging consultation fees. And for you consultants that are telling people to charge consultation fees, get out of the business. Go to vocational counseling. Do something. Have your head examined. Bad advice. And there's no way a practice consultant that actually is giving you advice to charge a consultation fee over the telephone, that they worked for somebody else that used to preach that. And because if they were in a practice, they would know that that's not a good idea, period. Now, there are exceptions to every rule, but I wouldn't charge a consultation fee under any circumstances. So for those of you that you're in an office that you can't talk the owner, you can't talk the surgeon, or maybe the surgeon's 8 months booked out, right, with patients. And I think if you're 8 months booked out, you may have to raise your prices a little bit to weed some of those people out. But if there's nothing I can say, nothing I can do to persuade you to waive this fee for x-rays or ultrasound or whatever, then what I would suggest you do is don't do it until you have booked that patient on the calendar. Then what you're going to have to tell them is, here's what you have to bring on day one. We're going to be doing an ultrasound, or we're going to be doing a CT scan, or we're going to be doing a digital x-ray. No matter where you go, you're going to need this done to get an accurate diagnosis or to give you an exact figure. In fact, you could take our x-rays and you could take them or images and take them to other doctors if you're really concerned about price, and that will be $150. But if you move forward with treatment with us, which chances are you are, then that will come off the price of the procedures. That's one way to handle it. If you go to Alvarez University, I'm going to give you 30 different ways to handle that because this is a big topic, but stop charging consultation fees. And again, if the consultant says you should charge a consultation fee because your time is valuable, you need to hang up on that consultant. Get a new one. Get one that's modern. And I'm sorry to be so adamant or so passionate about this, but they just flat out don't know what they're talking about. That's this week's report. We'll see you next week.